Device thrombosis is a serious adverse event for patients with mechanical circulatory support devices. In the November 2015 JACC heart failure lineup, you will find a mini focus issue, Mechanical Circulatory Support Opportunities and Challenges. And one of those papers, the first one I believe, is Identification and Management of Pump Thrombosis in the Heartware Left Ventricular Assist Device System, a novel approach using log file analysis. So the first question for Dr. Nir Uriel, who is an associate professor and the director of heart failure, transplant, and mechanical circulatory support at the University of Chicago Medical Center, is very simple. Let's talk about log analysis.
Wonderful. So again, just to emphasize, this is the LVAD, another left ventricular assist device coming from a company that's called Heartware. Have unique property. It's partially magnetic levitated, not completely like the HeartMate 3, partially magnetic and partially hydraulic. As such, we still can see device thrombosis that accumulate. According to Dr. Samar Najjar paper in JHLT, you found that 8% of the patient will have device thrombosis. However, here the mechanism is different because there is no bearing. So the clot itself may be platelet clot, and maybe this clot can be dissolved by giving TPA, and we don't have to run into a device exchange. For that sense, the log file came into action. This device technology contains a wonderful, wonderful screen that we can see the flow, the pattern of the blood throughout the pump over time. We can see the power consumption. And from that, we can learn a lot of things. What I definitely can learn is that whenever there is a constant activity of the pump and everything is fine, the power seems to be stable. The flow seems to be going up during systole, going down during diastole, and have a classical waveform. However, when there is a thrombus inside the pump, we can see an increase in the consumption of power in order to maintain the same speed, because something is blocking it. So we can start seeing elevation in power. The flow is generated by the power. And that's the reason we can see immediately elevation of the flow. It's a flow estimator. It's not a flow measurement. It's a mathematical calculation that's coming from those power. And as such, there is a classical fingerprints that we can identify in those log files. That by looking at those fingerprints, we can say this patient have a device thrombosis. However, this is not enough. You have a device thrombosis. How can we treat it? Is it going to be treated by a surgery that will take this pump out? Right. Or we can give TPA. For that extent, what we can look is on two different parameters. This is how beautiful those log files are. And to see that there is a time interval that it takes the power to go up. So the increase in the power, how much time it takes it to increase in the power, and how high the power is going on, can give us a clue if this is a clot that will respond to TPA therapy or will not respond to TPA therapy. Again, this is something that we done from a multi-data collection thanks to Heartware that help us achieve that, from people that send us information about device thrombosis all over the country, while we look at those log files in retrospect and said, wow, this log file get TPA and did not respond. This log file get TPA and did respond. We learned, for example, that if the power consumption is going to have 200% of the original, that together with a slope that is a little bit slower, surprising slower, those are not responding so well to TPA. So better, maybe we should go directly to device exchange using a big surgery. But if anyhow the TPA is not going to be helpful, why to try this technology and risk? So this is something small. It still needs to be validated, but it gives us another key to learn those pumps are metal and we cannot see what's going on. Right. But maybe from the outside, we have some insight to what's going on inside the pump and treat those patients.
Well, we do know that device thrombosis is a serious adverse event for patients with mechanical circulatory support devices. So the fact that you can not only see this and maybe intervene, but now you know that this is a way you can treat some of them. I think it's a fascinating story. So what you're saying is pump thrombosis is often preceded by this increased power consumption, and that's what you're looking for.
Yes, exactly.
Terrific. And just finally, how would this work clinically? I mean, this is right now a great idea, and it's in JACC interventions. How would this work clinically?
So this is actually going to be the next step for the company and we are clinically already using it. So I had a patient that I had suspected of device thrombosis, and I called the company and I told them, I know that it's not validated, it's not, but tell me, what is the slope, what is the amount of elevation? And if we thought that this combination is not responding to TPA, or did respond, in our specific case, we thought that it's going to respond to TPA, and we gave TPA, and we successfully emulsed the device thrombosis. But it still needs to be validated. The company will need to provide probably the user, when they have identified a device thrombosis, the two parameters, and tell us. Actually, in the next phase, maybe it can be automatically. The pump itself will be able to identify that you have a device thrombosis and tell you, this is the device thrombosis, that look, maybe it can respond. Again, I want to say, this is still early. It's a lot of patients in this study for device thrombosis. For device thrombosis study, it's a pretty big study. However, still need to be validated. We are very excited by the opportunity that we think that we can differentiate those two cases, responder and non-responder, from the outside. And we think that the company will be able to develop an algorithm that will give it to us in the screen, because we have the screen. It's very advanced technology.
Well, please look at the JACC Interventions November 2015 issue for this paper. It is fascinating. And for all of us here at CardioSource World News, please check around for our 2015 coverage of the American Heart Association meeting. I'm Executive Editor Rick McGuire.